Dr. Lora Barke is a fellow with the American College of Radiology. Dr. Barke is a leading voice nationally for the importance of screening mammography for every woman over the age of 40 every year. She brought the first 3D mammography units to Colorado. In 2019, she was awarded the title of Fellow of the American College of Radiology for her outstanding teaching of diagnostic radiology and significant contributions to clinical research and literature, all with the goal to save lives through early detection.
Joining us. My name is Lora Barke. I am a breast radiologist and I am the medical director of Envision Sally Job. I am here today at our facility in the Denver Tech Center. So welcome. So how many of you actually know someone who's been diagnosed with breast cancer? And now I can't see you, but I'm sure many of you are raising your hands, if not all of you, because breast cancer is very prevalent. It is the most common cancer in women if we exclude skin cancer. So 1 in 8 women will be diagnosed with breast cancer. So many of you probably know someone. So you may get a phone call from a friend or a family member, and they may say, I have breast cancer. So what is your response? Your response is typically something to help encourage them, give them words that will help them along the journey, such as, you got this, I am here for you, you're going to beat this, right? And the reason you're saying that is because you want to be there for them. But you're also thinking in the back of your head, what size is it? Has it metastasized? Is there anything we can do? Because you're worried about your friend or family member and you want them to do really well. So the question is, have they been screening? And just as mentioned with lung cancer, it's really important to find disease early. So early detection is key. Early detection essentially means that you have more surgical options, you have potentially less treatment that will be needed for that, and the treatment will be more effective. That is data proven. So there are a couple life-saving points I want to get across to you today, and I'm going to form them in questions so that you can be engaged in this WebEx since I can't see you. So this is not a quiz. I am going to give you all the answers, and here are all the answers. All the answers are yes. Okay, so the first question is, should I get a screening mammogram if I have no family history of breast cancer? Answer is yes. So yes, you should get a screening mammogram. And the reason is that almost 75% of breast cancers, if not more, are found in patients without a family history of breast cancer. Okay, question number 2. Question number 2 is, should I get a screening mammogram every year? And the answer is also yes. It is very important to get a screening mammogram every year. Women who screen every year, there is a reduction in mortality of about 40%, if not more. So you can imagine if you don't get that screening exam every year and perhaps wait till maybe every other year or something like that, we're going to find more advanced disease. The gold standard in screening for breast cancer is starting at age 40 and screening every year. And that's what's going to give you that mortality reduction. Okay, question number 3 is, if I have dense breasts, or maybe I have a family history of breast cancer, should I do something in addition to a mammogram? And the answer is also yes. So patients who may have dense breasts or a family history of breast cancer, you may want to start screening earlier than 40, depending on the age in which your family member was diagnosed. And dense breast tissue is something where we have found that adding something like screening breast ultrasound can be helpful. So screening breast ultrasound or adding an MRI study to an annual screening regimen, including mammography, can help find cancers earlier. Okay, last question. You guys are doing really great. Okay, the last question is, if I am due for my screening mammogram, or if I have a clinical complaint such as I'm feeling something, I have a palpable lump, I might have skin changes, or I have nipple discharge, should I feel safe coming into one of our breast centers? And of course, the answer is yes. As you have heard, coming into a healthcare facility right now is a very safe place. We clean the machine between patients, before and after. We take precautions. We wear masks, and I'm not wearing mine right now, but it's right here. And the reason is I'm in a safe environment right now because I wanted to speak to you without a mask. We are screening ourselves and our patients before coming in. So we want you to feel comfortable coming into our space. So I just want to summarize, and I hope you have kind of taken in some of these important points. One is early detection is very important and is key. Two is that annual screening mammography starting at age 40 every year saves lives. With or without family history, you should still be coming in, okay? And then number three is we've created a very safe environment for you to get your breast care. So please come and see us. So I just want to get back to your friend or family member that contacted you by phone and said, I have breast cancer. So I want you to feel confidence in your answer, in that warm reply that you give to your friend, that they are going to beat this and you are going to be there for them, and that you got this, girl, because they've been getting. We're on a pause during COVID and we were not able to screen due to Governor Polis's mandate. We have now seen a resurgence of women coming in. We've opened more slots. We're open on Saturdays so we can accommodate women to come in that are interested in screening. I should mention that even pre-COVID, not all women get screened, and only about 65% of our population are very good at getting screened. So we have an opportunity, and this is, it's time to educate everyone to make sure that they do come in and get the screening exams that they need, because as you've heard today, early detection is very important. The message is again that mammography works and it does save lives. So if there are apprehensions or fears with regards to getting your screening mammogram that perhaps even prior to COVID you were concerned about, please try to overlook those. We are here in a safe environment. Only about 10% of women get called back from a screening mammogram, which may lead to additional tests. Again, don't be fearful. We are here for you. And our goal is to find cancer early so it's more treatable, and that your outcome will be better. So tell your friends and family to do the same. It's really important to create a good community of people that will help each other, not just when there's cancer, but also when there are apprehensions to just get a test in general. So hope to see you soon.